I'd like to show a case here that shows a combination of Invisalign orthodontic treatment with upper and lower veneers. So here you can meet Sarah. Here we see Sarah before any treatment. She was unhappy with her bite and the appearance of the teeth. You can see from these side views that she had a reverse bite where the lower front teeth are farther forward than the upper ones. There are spaces between some of the teeth, and some of these spaces had been previously closed with resin bonding that was beginning to chip away. Also, the teeth were poorly proportioned and that they were too wide relative to their length. So here we have a problem that's not only aesthetic but functional also. We decided to use Invisalign first to correct the bite and then place veneers over some of the teeth to finish the aesthetic improvement. A series of clear Invisalign aligners were used over a period of about 15 months to correct the bite and bring the teeth into proper alignment and function. So at the end of Invisalign treatment, the upper front teeth were in front of the lower front teeth, which is what the normal relationship should be. So here you see the result of the Invisalign treatment, which is quite nice. We've got a proper bite relationship now with the front teeth. And she's ready at this point to proceed with enhancing the smile. The goal was to improve the proportions of the teeth, make them longer relative to their width. This would also correct the reverse smile line, which you see here. The upper front teeth would be a little bit longer, and the smile line or the edges of the upper teeth would follow the curvature of the lower lip. We could also make the teeth a little whiter and a little brighter. So again, after Invisalign here, you can see from the sides that the bite has been nicely corrected. So at this point, we took diagnostic records to help design the desired smile. A wax-up was made by the laboratory that to serve as a prototype so we could start envisioning what the end result would be. And this would also aid me in preparing the teeth, as some preparation matrices would be made from the diagnostic wax-up, because I wanted to be as conservative as possible when making the veneers, as many of her teeth were quite healthy, so I did not want to remove any tooth structure unnecessarily. We planned to make 10 upper veneers, and after they had been placed, Sarah would decide if she wanted to do the lower ones. So here you see the upper 10 teeth in the provisional stage. They've been prepared for the veneers. The veneers are being made in the lab, and she's got temporary veneers or provisionals in place. So this allows us to preview the smile and to see if we need to make any changes in terms of the lengths of the teeth or the shapes or the position of them. If we make any changes, then these changes can be communicated to the labs, and they can make the change to the porcelain teeth so that there are no surprises when we get the final result. So here are the 10 porcelain veneers in place, and there's a nice improvement at this point. The teeth have better proportions, and the smile line is more aesthetic. Also, the color is a little bit whiter and brighter. The lower teeth are still a little bit more golden in color, and Sarah decided at this point that she wanted to go ahead and do the lowers as well. So here from the side, you see the 10 upper veneers from one side and the other. And by treating 10 teeth on the top, it's possible to wrap the changes around from the front of the mouth to the back of the mouth to make the appearance much more natural. If only 6 or even 8 teeth had been done on the top, there would not have been a smooth, natural transition from the front of the mouth to the back. So here's Sarah after she's had the 10 uppers and 8 lower teeth veneered. We've got a nice smile, a nice result. And if we look close up here, we can see how the top and the bottom blend together, and it completes the picture and gives her the perfect smile she was looking for. From the sides, you can see the 10 upper and the 8 lower veneers. The top and the bottom match nicely, and they blend well from front to back. And here's a before and after of the smile from the front. You can see the nice correction in the bite and how the upper teeth have been lengthened into better proportions. Again, a before and after from the side, showing a nice transition from the front to the back, and from the left side showing the same thing. So overall, I think here we got a very nice result with a combination treatment of orthodontics using Invisalign to correct the bite, and then finalizing the aesthetics with upper and lower veneers.